All right, thank you for being on today as we discuss the neutrophil to lymphocyte ratio as a predictor of heart disease. And could need for protective measures be hidden in plain sight on your labs? Now, this will be cool for you. It might sound nerdy right now, but I suspect it'll probably make you want to go back and look at previous labs you've had run on yourself to investigate what your neutrophil to lymphocyte ratio has been over time, and maybe help you understand your risk for heart disease or death from any cause. Because, we've all experienced, or many of us have experienced, going to a medical doctor with a complaint, and we have labs run hoping to find answers as to why we don't feel well. And you get that frustrating smiley face from your doctor saying, "Nope, Joan, all the labs look good. You're healthy as a horse." And it's like, well, no, I wanted to find something wrong so that we had something to fix, right? And I see patients almost daily, definitely weekly, that we go through old lab work that previous doctors have given them smiley faces for, and hidden in plain sight is a marker of chronic inflammation that's helping to explain their long-term suffering. So I want to peel back the curtain today to show you that, so that you can look at your labs and see if this is at play in your case. And then further, I want to show you how this can help you understand your cardiovascular disease risk, even if you don't have a sign of it yet, like high blood pressure or other issues. So first of all, we need to understand what a neutrophil to lymphocyte ratio is. Excuse me. So this is a CBC, which stands for complete blood count. And this is a lab test that is run in every doctor's office across America. This is standard blood work. This is what you get as part of your yearly physical. So the CBC stands for complete blood count, and that would include your white blood cells, your red blood cells, your hemoglobin, your hematocrit, the MC series here, and platelets. And then to be extra complete, I think you should not get just a CBC, because that ends right here, this much. You need to also have the differential. The differential is key, because the differential is what allows us to get more nuanced with your immune system. If you don't have the differential, which is all of this, that could leave you hanging and could leave us handicapped in terms of figuring out what's going on with just this simple, inexpensive test. So always ask for the CBC with differential. Why might the differential matter? Well, it's crucial for our discussion today, because we're talking about the neutrophil to lymphocyte ratio, the NLR, okay? And that is driven by your neutrophils and your lymphocytes, which are part of the differential. So if you don't have a differential, you can't run an NLR, and we don't have this information. So again, always ask your doctor to run the CBC with the differential so that we can have this information. Now, real quick, before we get into the neutrophil to lymphocyte ratio, I want to just explain a little bit how to look at this. So up here at the top, when we're looking at your immune system, we're interested in the white blood cells, okay? So your white blood cells, I think of as your total military. Do you have enough soldiers? The answer would be yes or no. And for this person, the answer would be no, because their white blood cell count is lab low. So we could say this person definitely needs to go out and do some recruiting to get more people in the military. All right. So one thing we want to know when looking at your immune system is your total amount of soldiers. Do you have enough? This person, no, they are immune suppressed. That's the first thing we want to know. The second thing we want to know is, well, of all the soldiers you have, right, of your complete military, how are all the soldiers you have divided up into Marines, Army, Air Force, Navy, Coast Guard? Okay, because it's not enough to just have a military. You also have to have different specialties, because you might fight on sea in one battle, but in the air in another. So the Navy might not be as efficient at fighting in the air as the Air Force, and vice versa. So we want to have all the branches. And there's two ways to look at the differential. You can see here there's a percentage or there's a count, okay? And the percentage is the relative amount of cells, okay? So of the 100% of soldiers that you have, 69% of them are Marines, 20% of them are Army, okay? Makes sense? So the percentage is the relative amount based on 100% being the total. All right, so that's how you look at the percentage or the relative amounts. Then the count, this is the absolute number. So this is the lab took your blood and put it on a slide under a microscope, and they counted every single Marine that you had, okay? And every single Air Force member that you had. So there's two different ways of looking at it. Both are useful in different situations. So there's like a primer on the CBC with differential in terms of why we run it and what we're looking at a little bit. But now, if we want to dive into the neutrophil to lymphocyte ratio, which is the main focus of our video today, we can go over here to the players involved, the neutrophils and the lymphocytes. And the neutrophil to lymphocyte ratio is a ratio of the neutrophils and lymphocytes, like I said, where you divide the neutrophils by the lymphocytes, and that gives you a number, okay? And the number, if it's greater than 2, equals chronic inflammation, chronic systemic inflammation, by the way, so whole system on fire. It increases risk of cardiovascular disease, and it increases risk of death from all causes. Okay, so it's very important to be able to run this number, and it's available for everybody who's ever had labs drawn in the US. So if we look at this person, if you divide their neutrophils, 2.51, by their lymphocytes, which is 0.73, you get a 3.55 number, okay? 3.55 is greater than 2, so this person is chronically, systemically inflamed. They are on fire. And per this marker, they also have an increased risk of cardiovascular disease and increased risk of death from all causes. So how can we help this person? Well, we want to go find out where and why they are inflamed, and that inflammation is creating this number. And if we can put that fire out, this number drops, the cardiovascular disease risk drops, risk of death from all causes drops. So all this information is right here on this page to help us help this person. And in most offices, the doctors don't even know about the neutrophil lymphocyte ratio. And in most offices, this person would have got a smiley face, or because of the different lows and highs here, they may not have got a smiley face, but they may have asked the doctor, well, if they did get a smiley face, well, what about these lows and highs? And the doctor oftentimes brushes it off as like, oh, well, we'll follow it or we'll watch it, because there's not a drug to give you to raise this or to lower this. So unless there's a prescription ready issue on your labs, they just follow it or give you the smiley face. And we don't want to do that, because if that's this person, they move forward continuing to be on fire and maybe have a cardiovascular event, and the doctor's like, well, I don't know what happened, they were so healthy. And it's like, no, doc, hidden in plain sight was a chronic fire. So this is it on a set of labs. Now let's dive into the research to learn more about this and how it ties to cardiovascular risk. All right, so here we are with the research, and this is a study from 2022 in Biomedicines, and it's entitled Usefulness of the Complete Blood Count to Assess Cardiovascular and Metabolic Diseases in Clinical Settings. So again, this paper is studying how we can use the CBC to investigate for cardiovascular disease, for metabolic disease, such as diabetes and other things. And if we go down here, complete blood count is one of the most common blood tests requested by clinicians across the country. Okay, it's standard of care. Recently, many investigations have suggested that the risk of cancer, heart disease, arteriosclerosis, diabetes, and metabolic syndrome can be predicted using CBC components, or complete blood count components. This review introduces the white blood cell count, the neutrophil to lymphocyte ratio, etc., as useful markers to predict cardiovascular metabolic diseases. Okay, so it's worth reading if you're a clinician. Today, I'm just going to focus on the neutrophil to lymphocyte ratio for our purposes. So if we dive down to that part of the study, we can see here, all right? So the ratio obtained by dividing neutrophils by lymphocytes, like we said earlier, right? Hold on 1 second. So we're talking about the neutrophil to lymphocyte ratio, or neutrophils divided by lymphocytes. So the ratio obtained by dividing neutrophils to lymphocytes is called the neutrophil lymphocyte ratio, and is a useful biomarker that indicates the balance between systemic inflammation and immunity. The neutrophil lymphocyte ratio has been investigated as a predictive and a prognostic marker in several diseases, such as various cancers and cardiovascular disease. One advantage of using the NLR is that even when the white blood cell count is in the normal range, if the NLR is 2.5 or higher, clinicians can identify chronic low-grade systemic inflammation. So hear that, even when the white blood cell count is normal, right, a high NLR can identify chronic systemic inflammation hidden in plain sight. And this study here says 2.5. There's many papers on the NLR. And so if you look at the many papers together, it's actually greater than 2 is dangerous. Okay, so I use the 2.0 marker, not the 2.5. In addition, neutrophil lymphocyte ratio is useful in clinical practice because it can be calculated easily from the CBC using the differential count result. So again, we need that differential and we need the absolute count. Okay, and most of us have achieved a level of math where we can do simple division, so we don't even need a calculator most times, unless you want what's after the decimal point. But it's easy to see, hey, this number divided by this number is 2 or 3 or 4. Scrolling down now. Okay, neutrophil lymphocyte ratio and heart disease. So blah, 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 a bunch of stuff here, but we'll say right here, an elevated neutrophil to lymphocyte ratio was associated with an overall mortality increase of 14%. So if you've got a high NLR, your risk of death from all causes is increased 14% at minimum, okay? And heart disease risk of death is increased 17% with an elevated NLR. In addition, in healthy people without known diseases, NLR had a positive association with mortality from heart disease. So basically what that's saying is even people with no diagnoses, quote unquote, healthy, smiley face people, if the NLR is high, there's a positive association with risk of heart disease. Scrolling down. The relationship between coronary artery disease and NLR has been studied extensively. NLR was associated with calcium score, so coronary calcium score, if you've ever had one of those, and risk factors for coronary artery disease. It was associated independently with arterial stiffness and was suggested to be a high predictive marker of arterial stiffness. So again, the stiffer your arteries, the higher your blood pressure, the harder your heart has to work to pump blood, and the increased risk of cardiovascular disease. Because endothelial dysfunction is caused by neutrophil endotherm interactions, and we're going to see more of this in a moment, an NLR increase could increase risk of coronary artery disease. Okay, so it could represent endothelial dysfunction, which we've talked about in previous videos. The relationship of decreased nitric oxide leading to increased endothelial dysfunction, which occurs 10 to 20 years before the first poor blood pressure reading or the first sign of heart disease. So an NLR, again, could catch us 10 to 20, could help us 10 to 20 years early if it's showing us endothelial dysfunction. NLR has been used to predict the occurrence of major adverse cardiovascular events when patients with coronary artery disease undergo non-cardiac surgery. Findings indicate that NLR as a clinical marker to confirm improvement in coronary artery disease patients and an indicator to prevent and predict occurrence of coronary artery disease. So it has utility across all patients, from healthy patients that have no history of anything to patients who have already had coronary artery disease issues, and everyone in between. And then also in metabolic diseases, NLR was sequentially higher in the pre-diabetic, newly diagnosed diabetic, and previously diagnosed diabetic without complication groups than in the normal group. So basically what that says is the worse your blood sugar gets, the higher and higher your neutrophil-to-lymphocyte ratio is, representing the chronic inflammation caused by the high blood sugar. So this is, again, a very important marker that we want to pay attention to. And for further context, here's a study looking at the tissue damage caused from high neutrophil levels or a high neutrophil-to-lymphocyte ratio, and in the context of COVID. And so, you know, COVID is a recent thing that's on everybody's mind. And so it's interesting to learn about it in that context. But remember, this can happen, as the previous study said, even in healthy people with no history of cardiovascular disease or COVID or anything else. So if we jump into this abstract, it says the high neutrophil to lymphocyte ratio observed in critically ill patients with COVID is associated with excessive levels of reactive oxygen species. Now, whether you have COVID or not, the high ratio is associated with that, with high levels of reactive oxygen species, because neutrophils pump out a bunch of reactive oxygen species. Another name for that is free radicals. Lay people watching this have probably heard the term free radicals more likely than they've heard reactive oxygen species. And basically, free radicals or reactive oxygen species damage your tissue. Metaphorically, I like to say that they cause rust, okay? And you don't want to rust from the inside out. That ages you quickly and kills you faster. So you read health blogs and you read about antioxidants, and you take antioxidants to fight pro-oxidants or oxidative stress or free radicals, okay? So when you're drinking your berry juice and taking antioxidants like astaxanthin or luteolin or whatever's sexy in the health blogs right now, antioxidants fight these things, okay? Why do we want to not have too much reactive oxygen species, too much oxidative stress, too much rust? Because rust promotes a cascade of biological events that drive pathological responses like tissue damage, blood clots, red blood cell dysfunction. And in the context of COVID, all of those things, the more of those you have, the greater the disease severity. So right here, you can see that the author suggests that free radical scavengers, or another way to say that is antioxidants, could be beneficial. They say here for the most vulnerable patients, but for all patients, right? Anyone with a high oxidative stress load, anyone with high rust, anyone with a high neutrophil-to-lymphocyte ratio could potentially benefit from free radical scavengers or antioxidants to help push back against the damage being caused by the high NLR, which is representative of an imbalance in your immune system, too much inflammation. So let's look at this in a picture. And again, this is in the context of COVID, but this is relevant to anyone that is concerned with preventing cardiovascular disease and looking at an NLR to help us do that, our neutrophil-to-lymphocyte ratio, okay? So up here on the top, A, these are not at-risk individuals, okay? So we could say these are healthy individuals with a balance. You can see the scales here with a balance between pro-oxidants or reactive oxygen species and antioxidants, okay? These people, whether we're talking about COVID infection or flu infection or, you know, any disease that's going to increase oxidative stress, increase neutrophil response and inflammation. If you've got balance between pro-oxidants and antioxidants, then you can deal with it and you can put that fire out, right? You get a balanced defense mechanism. If we have some rust forming, we have all these little red anti-rust, antioxidant things to help us neutralize that. And if we don't have enough, we could treat with antioxidants to increase our defenses. Okay, that's people with a normal NLR for the purposes of our conversation today. So let me write that so that it stays. So these people would have a normal NLR. But down here, these people have a high NLR, high neutrophil-to-lymphocyte ratio, which would be greater than 2. Okay, and so you can see here they have high levels of pro-oxidants, which are produced by neutrophils. Okay, which you can see right here. An activated neutrophil produces a lot of oxidative stress or reactive oxygen species. And those reactive oxygen species can damage red blood cells. And when red blood cells are damaged, they can aggregate into clumps and cause clots, and cause all kinds of blood flow issues, and maybe you can develop arteriosclerosis and other cardiovascular issues that lead to events. Okay, so if you don't have enough antioxidants because your levels are too low, then you can't fight the rust. And what happens? We get a perpetual cycle of worsening. So you get extra rust, you get red blood cell dysfunction, you get blood clots, you get lung damage in the case of COVID, or you get worsening of whatever you're dealing with. So remember that a high NLR is increased chronic systemic inflammation. So whether that's inflammation is because of a COVID infection or an autoimmune disease or cancer or diabetes, whatever we're talking about, the imbalance perpetuates that. So we need to find the driver of the inflammation and address that. And to help us balance this imbalance, we can support with antioxidants while we're trying to buy time to change the lifestyle strategies that contribute to the issue that we're dealing with in an individual. So I hope that this is enlightening for you. I hope that this kind of made you say, oh, wow, and makes you look at your labs different when your doctor says, gives you a smiley face and says everything is good. You know, if you get that CBC with the differential and you get a smiley face, before you are too happy about it, go down to the newts and the lymphocytes and divide them. And if it's less than 2, then you can be happy about your smiley face, and you can even put a smile on your own face and move forward and keep living healthy like you are. So let's open this up for questions.
I have a question.
Mm-hmm.
So assuming we can get enough antioxidants from diet if we have a normal ratio, correct? What if we don't, if our ratio is above 2, do you think we need extra help with, taking some form of supplement with antioxidants, or do you think diet alone can help reverse, and help lower that ratio?
I think short term, you're probably going to need support. And, it's a little bit tough of a question because each case is different. But if the NLR is high, remember, we don't want to just take antioxidants and move on. We want to figure out why or where is the inflammation, where is it coming from, right? So, increasing your whole food antioxidants you can do right away. And then you may also want to supplement with antioxidants while you're going through the process of testing or diagnostics or whatever you're doing to figure out, well, where and why am I inflamed? And, you're not necessarily going to put that out overnight. So you could use, you can always use diet, and then you could support with supplements while you're waiting for results and then implementing a plan over time.
Thank you.
Make sense?
Yep.
Cool. And the best antioxidant, the body's master antioxidant, I know you know this, Sue, but just for the viewers, the body's master antioxidant is called glutathione. So if your case is one where you're like, hey, we need to support the antioxidant side of things, supporting increased glutathione is going to likely be really helpful in most cases, because that's our body's master antioxidant. Our body can make it. The supplement you may have heard of, N-acetylcysteine, is a precursor to glutathione. So you can take N-acetylcysteine. Some people don't convert it as efficiently as others to glutathione. So those people will want to take glutathione directly. Other antioxidants, superoxide dismutase is probably the second strongest for us. Catalase would be third. But then you have antioxidants like the berry-based ones, and the plant flavonoids and polyphenols and things that you find in blueberries and raspberries, and all the fruits and veggies out there. From a whole food diet, from glutathione support, you want to NAC is N-acetylcysteine. So cysteine is the amino acid that's key there, and cysteine is sulfur based. And so you want to eat high sulfur foods to get more of that, which, the best source there is the brassica family of vegetables, which are things like broccoli, cauliflower, bok choy, cabbage, that whole family. Okay. And so your body can break those down and take the sulfur from that and help you make glutathione. And then, they also have a bunch of other antioxidants, like broccoli sprouts have another powerful one called sulforaphane, which is a very powerful antioxidant. So like Sue was saying, if we're eating whole foods, we're not only getting the things we're intending to get from the food, but we're also getting the things that we may not even know are in the food that are also helpful to us.
With that, how would you know if you don't break down the NAC very well to glutathione? Like, what would be a sign or a way that you could test whether you're breaking that down well or not?
There are genetic interplay there. So there's enzymes that help you make glutathione, like glutathione peroxidase is one of them. There's a couple. So you could run genetic testing to know, do you have high functioning enzymes there, or do you have one good copy, one bad copy of the genes related to that, which may suggest decreased efficiency there. If you've got labs that you're following that suggest you need more glutathione, you could try with NAC first and then retest those labs. And if they've changed, the way you want them to, then it would appear in your case NAC is sufficient. If you take NAC and retest those labs and they haven't changed positively or to your liking, then it may suggest poor conversion. So then you could try glutathione directly, retest the labs. Oh, now they're good. Okay. That would be a way to trial and error, kind of figure it out for yourself.
Cool. If you have me on both, do I just keep taking both, knowing that I need both NAC and the glutathione?
Yeah, because the NAC has many functions beyond just becoming glutathione. Like NAC in and of itself is awesome. It's very powerful as an antiviral. It's very powerful as a mTOR inhibitor. It's a mucolytic, so it helps break up mucus. It does all kinds of things in and of itself. So with the things going on in your case, there's multiple reasons why we want both, and both are very supportive of optimal liver function.